As we close today, I'd like you to hear from a local gal, Rebecca Dillingham. She's from right down the road, and you can see her two beautiful little twin boys over here, Gabriel and Zeke. Now, they were born with transfusion syndrome, and I don't really know what that is, but it's not good, and it's expensive to treat, and you have to go to very specialized medical care, and the odds were against those two little boys. Now I'm going to tell you something. Read about Canada where kids get sick, young kids, and they can't find a neonatal unit in like all of Toronto, all of Ontario. Well, she was able to go to a highly sophisticated medical treatment center in Cincinnati, Ohio. And those two little boys, I'm looking at them right now, 9 months later, are in really good shape. And I don't care what it costs. Weren't they worth it? A government bureaucrat might not have thought so. Rebecca, will you come give us a few words?
Hello. Is that too loud? I'm here for two reasons today. Their names are Gabriel and Ezekiel. They are my identical twin boys whose lives were saved multiple times by the swift and comprehensive care my husband Stephen and I were able to purchase through his employer. And now our ever-encroaching federal government wants to take that away. On July 8th of last year, I had a 20-week ultrasound done at my OBGYN. The imaging revealed what my doctor called abnormalities, so he referred me to a local maternal fetal specialist. Just 2 days later, on July 10th, I had an ultrasound done with the specialist and was diagnosed with twin-to-twin transfusion syndrome, TTTS. It's a rare defect found in identical twins that share a placenta. We were told that if nothing were done, one or both of the twins would most likely die in utero. And the lucky few who do survive run an extremely high risk of brain injury and damage to vital organs. Since terminating my pregnancy was never an option for us, we decided to forge ahead with our first treatment. Just 4 days after my initial appointment with the specialist, I was back in his office for an amnio reduction, admitted to the hospital for a few days of testing, and then referred to the Fetal Care Center at Cincinnati Children's Hospital, one of only about 10 or so facilities in the country that treats TTTS by fetoscopic laser surgery. It's a procedure that was pioneered by American doctors back in the late 1980s. On July 21st, I was in Cincinnati, where I not only had a 2-hour ultrasound and a lengthy fetal echocardiogram, but I also had an MRI. 3 days later, I underwent surgery, where world-class surgeons severed the vascular connections in the placenta that were threatening the lives of my babies. TTTS is a disorder that progresses quickly, so time is of the essence, since 70 to 80% of twins die without treatment. The turnaround from when the abnormalities were found to the surgery was only 16 days. An amazing testament to the efficiency of America's free market healthcare system. For the duration of my pregnancy, I had prenatal visits at my OB every 2 weeks, 2 ultrasounds and 1 non-stress test a week at a specialist, and fetal echocardiograms done monthly. Finally, Gabe and Zeke were born by C-section at 34 weeks gestation and spent more than 2 weeks in the NICU. And since then, Zeke has also had a CAT scan and undergone lung surgery at Brenner's Children's Hospital in Winston-Salem. By the way, they're very healthy today. They're perfectly fine. Some people tell me the only reason Gabe and Zeke survived is because we're privileged, since my husband pays for private health insurance through his job. Not true. We would have gotten our children the care they needed, whether we had to pay 100% out of pocket or not. The point is not the money, as is always the focus in a rationed healthcare system. The point is that quality care and cutting-edge medical treatments are available to every American citizen. There are always private sector solutions to help those who cannot afford high-priced care. For example, there were signs all over Cincinnati Children's saying that no child would be denied treatment for financial reasons, because that hospital works with private foundations, not the government, to make sure that every sick child gets the medical services he or she needs. Knowing our story, consider that there's a 5-month wait for MRIs and CAT scans in Canada, a country whose government-run healthcare system our president and Congress pine to emulate. Consider that Germany is thought to have one of the best socialized healthcare systems in the world, yet the wait for elective surgery there is about 20 weeks. Obviously, under both systems, odds are Gabriel and Zeke would have perished, and I would have had to experience the trauma of miscarrying my 2 babies. Also consider that fetoscopic laser surgery is still deemed somewhat experimental, and survival rates post-surgery are statistically low. This is surely something the federal government's unelected medical advisory panel would have taken into consideration when deciding if the risks of the procedure outweigh the financial costs. Would the Obamacrats have denied Gabe and Zeke their chance at life, liberty, and the pursuit of happiness, all in an effort to cut costs? Yes. Would my unborn children be considered lives at all? Or would I have been forced to get a late-term abortion? Yes. Considering that we have a president who thinks that babies who survive botched abortions are not worthy of life-saving medical care, and that one of his medical advisors is on record as saying that slowing medical innovation is a way to control healthcare spending. I think the answer to these questions are glaringly obvious. As a citizen stating these truths, the White House Director of Communications and Democrat senators and congressmen will try to discount my message by calling me a Republican operative. I'm neither a Republican nor an operative. Our president will belittle me by saying my real-life story is simple chatter. Cable news talking heads will mock me by describing me as a teabagging redneck. By telling people that Obama is clearly on record as saying on multiple occasions during the presidential campaign he prefers a single-payer system. It will be said that I'm spreading disinformation or taking the president out of context. These are all tactics used to label the informed public as, at best, deluded fearmongers with no credibility, and at worst, just plain old stupid. Now that the sleeping giant of the American middle class is finally waking up, we've got the political elite on the run, and they and their cohorts in the media are going to turn the heat up against us this August. They feel like they're losing control of the boat because we are reminding them at rallies and town halls and through our emails and phone calls that we hold the rudder, not them. Don't be scared to stand up for freedom of choice in healthcare. Don't let their emotional arguments sway you from your principles. Don't let the condescension oozing from Capitol Hill and festering in America's newsrooms make you ashamed of what's right and what's constitutional. Like Thomas Jefferson once said, truth is the proper and sufficient antagonist to error. Thank you very much.
Thank you, Rebecca. And let's give a round of applause for Gabriel and Zeke. Gabriel, and let's be clear, Gabriel and Zeke should never be rationed. Amen. Never.